Medics and patients are fleeing the main hospital in central Gaza today as fighting between Israeli forces and Hamas militants draws closer. Doctors Without Borders and other international NGOs have now pulled their staff from the hospital called Al-Aqsa, one of the few still functioning in Gaza, although it is continuing to receive patients. The World Health Organization's emergency medical coordinator, Sean Casey, did manage to reach the site yesterday, where he recorded a short video from inside the emergency room. Let's start the programme then by listening to what he had to say from the.
I'm in Al-Aqsa hospital in the middle area of Gaza, the middle part of the Gaza Strip, in the emergency department where they're treating children, several children on the floor and on a gurney behind me, doctors calling out for scalpel and chest tubes, many people coming in from an explosion. There's one child who unfortunately passed away whose body is not identified, and it's, as you can see, a chaotic scene. Unfortunately, this area is close to an area that was evacuated yesterday. An evacuation order was issued, and they've lost a lot of their staff. This hospital is currently operating with about 30% of the staff that it had just a few days ago. They are seeing, in some cases, hundreds of casualties every day in a small emergency department. Yesterday they said they had one doctor working overnight in this emergency department with hundreds, in some cases, of casualties coming in on a daily basis.
A snapshot there then of the immense challenges at Gaza's hospitals today. Let's get the very latest then on what is happening. Our correspondent is Iris Makler and she's live with me from Jerusalem. Iris, fighting then around that hospital. We just heard from that spokesperson there in Deir al-Balah in the centre of Gaza, and it does seem the fighting now concentrating in the centre and in the south of the enclave.
That's right. You know, it was very good to hear from that WHO representative, because I think it's a summary of the challenges that are being faced, even as more humanitarian aid is getting in. It's how to get it to the places that need it. We heard from another official of the WHO today saying that it's now the fourth time they have put off sending aid in to the north of the Gaza Strip because it's just too dangerous. It's simply too dangerous. There are bombardments, there isn't enough communication, and even though there are humanitarian corridors, there's no safe way of getting in. They said it's the fourth time since December the 26th that they have not sent aid into the north of the Gaza Strip. There aren't many civilians left in the north, but nevertheless, you know, they wanted to go to the main hospital there, Al-Aqsa, and they wanted to go to the main drugstore, and they haven't achieved that. It is interesting that we are seeing Israel de facto withdrawing troops from the north of the Gaza Strip. It's quite interesting in a political sense, because we don't hear it from Israel's politicians. Over the past 2 to 3 days, we've been hearing it from the military and seeing it as a fact on the ground. But tens of thousands, at least thousands, of reserve officers being moved out of the north of the Gaza Strip. And now today, for the first time, we heard a politician confirming that. That was Israel's defense minister. So I think we are seeing a change on the ground. The fighting, as you say, concentrated in the center and in the south, mostly in Khan Yunis, the town where Israel believes that the Hamas leader, Yahya Sinwar, is located. Although it seems to me he might well have moved further south, where there are not so many Israeli troops. And it seems, from what we're hearing from Israeli military analysts, unlikely to be a major Israeli push there in Rafah on the border with Egypt.
OK, Iris, so that's an update then of what's happening this Monday in Gaza. Take us, though, to Israel's border with Lebanon, because Lebanese sources saying today that a Hezbollah commander has been killed in Israeli fire in the south of Lebanon just today. And it really does seem that tensions on that border once again are heating up.
Yes, it's been heating up ever since, I guess, the assassination of Salah al-Aruri, number 2 in Hezbollah, killed in Beirut, in the area of Beirut that Hezbollah controls. That was a week ago tomorrow. So in that time, we've heard from the Hezbollah leader twice saying that a response is urgent. part of the response has been an escalation on this border. And today we've seen that as a part of Israel's response to that, there is this report of a senior commander in the Radwan force in Hezbollah's militant force being killed. And we're hearing from Lebanon that could cause a further flare-up. But I'll say this, this is an escalation that could at any minute spiral into a full-scale war. And that's what's very frightening about watching the northern border. That's Israel's northern border, Lebanon's southern border right now.
Indeed, Iris, and that's one of the reasons why Antony Blinken, the US's top diplomat, is in the region right now. He'll be in Israel later on today. What do you think we can expect from him then?
I think we can expect him to focus on the things he's been focusing on this whistle-stop tour, 9 countries in 6 days throughout the Middle East. And that is the day after in Gaza. What is Israel's plan? Here are the US plans. And here, that's part of what he's been doing in the Middle Eastern countries he's visited so far, including the UAE and Saudi Arabia today. That is gathering support for a day after plan and gathering support for funding for the day after for the rebuilding of Gaza, which, by the way, I don't think anyone will want to do in the absence of a plan. The other thing is definitely the northern border. I think the fact that this didn't escalate into a major war so far is one of the achievements of Washington during this conflict. It was their cajoling, persuading and threatening that have stopped it really becoming a major war on 2 fronts for Israel and a major war between Israel and Lebanon. And I think that's part of what they want to follow through with and insist on in the future as well.